As a general practice nurse, I see patients for a wide range of health issues which do not involve you seeing your GP. I have had extended training to manage these health issues, so ask the receptionist to book you in to see me for advice and treatment. The receptionist may ask you about your condition. This way, they can ensure you are seeing the right person with the right skills. We cover a vast range of health-related issues and are skilled at providing contraception advice and reviews, immunisations, wound and minor injury treatment. We also offer blood monitoring, lifestyle and health promotion advice, and chronic illness reviews such as asthma, lung disease and diabetes. As a general practice nurse, I am part of the primary care team, and primary choice is all about seeing the right member of the team to get the most appropriate treatment faster.